I'm John Deering. I'm a consultant orthopaedic surgeon based in Ayr Hospital in the west of Scotland. I'm a regional surgical advisor for the Royal College of Surgeons here in Edinburgh, and I'm leading in terms of physical activity and promoting physical activity on behalf of the Royal College of Surgeons here in Edinburgh, but also for NHS Ayrshire and Arran. There is increasing evidence that the amount of activity that you do will pay dividends throughout your life. And what we're trying to do is get the message over to patients and also to members of staff, medical staff, that physical activity is important, it matters. We can reduce the risk of cardiovascular mortality by doing 30 minutes of exercise a day, and that has as much benefit as having a normal cholesterol, not being obese, not smoking and not being diabetic. When I talk to a patient, I'll ask them about their presenting complaint, about their previous medical history, and then I'll talk to them about smoking, alcohol and their physical activity. And I will ask the basic screening question, which is, do you do 30 minutes of physical activity per day? And if the answer is no, then it's important then to be able to guide them as to what they should be doing. We're not talking about getting hot and sweaty in the gym, although that's good. But really what we're talking about is just being active, walking around, taking the stairs rather than taking a lift, walking or cycling rather than driving. Walking the dog is a fantastic thing. And doing just those 30 minutes of gentle physical activity a day makes a huge difference. There are various conditions which will benefit. In fact, it's easy to say almost every condition will benefit, because this improves both physical health, psychological or psychiatric health in terms of well-being. A lot of the research has been done in cardiovascular disease for the physicians, but also for surgeons here at the College of Surgeons, particularly in terms of malignancy. And it's the solid tumours, the breast, the prostate, in particular, and colorectal cancers, which it's been demonstrated that there is a reduction in the incidence of malignancies in folks who are more active, and also improved outcome. Scotland in particular has been identified as having a relatively poor outcome following treatment of colorectal cancer. And if you look at the figures, after 30 days post-operatively, the survival is the same. It's that initial 30 days post-operatively where the folks in Scotland are struggling compared to the rest of Europe. And it may well be that because we are starting with a less fit population, that's why we're getting the worse outcome. And so by promoting physical activity, we're reducing the incidence of malignancy and we're improving the outcomes. My particular specialty is knee surgery and sports surgery. There's been a push over the last few years to get patients more active up and about as quick as possible, called early recovery after surgery. And we've been very active with that across Scotland, and there's a big national programme to do that. And that improves not just the physical condition of patients, getting them up and about early, reducing deep vein thrombosis, reducing pulmonary emboli. It also improves psychological outcome as well, and the results in terms of how well they perceive that they're doing following, in my specialty, arthroplasty, joint replacement, is much better if they get going quicker, because you get the muscle back and you get the well-being back. So if you're a patient and you're thinking about doing more physical activity, it's very simple. It doesn't cost any money, it just takes some time. And really what you're aiming for is 30 minutes a day.